Hello, everyone. Thank you for your short waiting time. And we're very glad to see some known faces by now. Now we know people through webinars, through their little boxes on our Zoom screens. And I'm very pleased to see many of you joining us again in this webinar. This is, well, for those who are new to the webinars, I'm Triandafyilidou. I'm the Canada Excellence Research Chair in Migration at Ryerson University in Toronto. And as it has happened in this webinar series, we're very pleased to welcome international speakers, but also international attendees at our virtual seminar room. I think there are some good things about the pandemic, that we can connect more transnationally and hear what is happening in other parts of the world, something that is particularly interesting in migration studies. This is our last webinar for the summer period, and we will resume in September, even though we hope that in September our lives will be a bit more normal than they are now. Actually, in one of our previous webinars, we had focused on solidarity and how the pandemic has given rise to positive, to positive developments, to more solidarity, to reconsidering the role of migrant workers in different sectors. I think today we're focusing more on the vulnerabilities, on those people that have been most hardly hit by the pandemic, and on the particular vulnerabilities that migrants and those with precarious status among migrants are facing under the lockdown. I'm very pleased to welcome three great scholars, and also actually I should say that Margarita is a practitioner that will share with us their reflections, and that have, if you're interested, you can also read in our Pandemic Borders blog website their relevant contributions. So today we have with us Margarita Pintin-Perez from OCASI, the Ontario Council of Agencies Serving Immigrants. Actually, when I first arrived in Canada last August, that was one of the first stakeholders that was referred to me, Margarita, but it took me some time to learn what OCASI stands for. Although it's a very nice acronym, like easy to remember. So Margarita will tell us about non-status women and how they're really being affected in very specific ways during the pandemic. Then we have Michael Flynn, who joins us all the way from Switzerland. And he's the head of the Global Detention Program, really an issue that is relevant also outside the pandemic, how migrants and asylum seekers are often detained because of irregularities in their status. And Michael will speak to us about their latest initiative in documenting what happens with detention during the pandemic. And indeed, the fact that migrants are having a much harder time during this period, while we see, for instance, that some regular prisoners have been sent home in the effort to take some pressure off jails. And Petra Molnar is our third speaker from the University of Toronto. Petra Molnar has completed a very important study on artificial intelligence and how it impacts migration governance. And today she's going to speak really about some of the loopholes of using technology, using big technology in relation to migration, and particularly in pandemic times when we're all anxious about tracing of the virus, tracing of the cases, us being alerted if we have come in close contact without knowing with someone who is infected. But there are unfortunately a lot of issues there, particularly for people with uncertain status. So without further ado, I'll give the floor to our speakers. Some practical notes for those who are new. So we'll take the three speakers in a row, about 10 minutes each. And then while the speak, you can write your questions in the chat. You can do that while people are speaking or a bit later. Once they finish, I will group your questions from the chat and I will ask the speakers to answer them. And we'll be done, if not at 1 p.m., just shortly after that. So Margarita, without further ado, the floor is yours.
Great, thank you, Anna, and your team for organizing today's panel. It's a pleasure to be here and participate in this conversation with Michael and Petra. I might just add, I'm also here today speaking as a member of the Rights of Non-Status Women's Network. So I want to start by saying that we're in a collective mourning. We're mourning the death of Bonifacio Eugenio Romero and Rogelio Munoz Santos, both temporary migrant farm workers from Mexico. We're learning of the hundreds of migrant workers in Ontario who have tested positive for COVID-19 and the conditions that are not surprising or new for many, but which allow the virus to thrive. We're mourning the death of migrant workers in real time. These deaths are facilitated, routinized, and normalized by systemic neglect. COVID-19 has been a moment when the precarity and the temporal nature of immigration in Canada, the conditions, the risk, vulnerability inherent in this temporality is sharply revealed. Don't worry, I'm not going to do a precarious immigration status in Canada 101 because of time, but we know that immigration in Canada is stratified at various levels with limited pathways to regular and permanent status, and this is especially relevant in recent years. Canadia's immigration policy has become increasingly reliant on temporary migrants through programs such as the Temporary Foreign Worker Program. And so this is inherently, this type of temporality increases vulnerability and the potential loss, the loss of status. And people may lose their status in a variety of ways. And what is the difference when we're thinking about economic migrants, forced migrants, those with precarious status? In Canada, we're looking at something that's largely bureaucratic, a form of administrative violence, to borrow a term from Dean Spade. It means that migration is occurring under very unequal, precarious, and dangerous conditions. And the reality is that once we've established these boundaries, the conditions, the restrictive kind of temporal and precarious forms of being in the state, it establishes what Bowman has referred to as this kind of living dead. So what's the solution? And what's the demand that we're hearing is status for all. What we've heard less about in the news, reporting, and public discourse, and what I want to focus on today is non-status women. I want to speak to the unique tensions and challenges that non-status women face in the context of COVID-19. And in fact, I'm going to ground this talk today, drawing mainly from our analysis and discussions, conversations around gender-based violence against non-status women and the intersectional impact of COVID-19. To start, non-status women remain largely invisible in the COVID-19 public health responses and emergency support programs. So while the Canadian government introduced new measures to support those facing financial strain from COVID-19, a key requirement is a valid SIN, a valid social insurance number. And this excludes undocumented migrants from receiving a very critical income support. What does this mean? If there's a lack of access to emergency income supports, such as the CERB, so that's the Canadian Emergency Response Benefits, and the Canada Child Benefit, we're leaving behind already very vulnerable people desperate to find shelter, food, and healthcare. For non-status women working on the front lines of the pandemic, this exclusion from emergency relief really intensifies what we're referring to as pre-existing issues of poor working conditions, a lack of paid sick leave, and low pay, and many are also at a heightened risk of contracting COVID-19 due to the working conditions without adequate protection. This, really makes us think about and question this really powerful and popular emblem of the pandemic. We're all in this together. It's a very romantic idea. Absolutely, responses and contagion measures really needed this kind of collective impact, the participation, the support. But the problem is that we didn't really have a system set up that would lead towards this. So it's a kind of generalized construction of the issue, this all of us. It relies on some key assumptions and truly it's structured on a false sense of unity around the experiences and the social locations of what it means when we're referring to all of us. There's race, class, and gender neutrality in all of this, and this leads to the erasure of some of the unique challenges and capacities to participate and receive benefits, especially for non-status women. And what we're learning is that during this global kind of COVID-19 pandemic, non-status women may be among the most exposed and the least protected. Claire, if you could please share the visual summary, that would be great. So kind of going back to the contagion measures and these ideas of social distancing and isolation, one moment. So leaving kind of the social distancing and isolation, it's really essential to recognize that the home can be a very unsafe place for non-status women. And it's now really well recognized that the crisis, as with any crisis, has increased incidents of gender-based violence. Non-status women facing violence in their homes often have fewer options for protection, as they may fear that calling the police or asking for help could put their ability to remain in Canada at risk. Non-status women experiencing abuse also have limited access to information, counseling, health services, and other social supports. Although there are agencies and shelters that are providing support, but this is actually not something new or surprising or emergent. On April 30th, which is now nearly 2 months ago, we introduced a series of roundtables, and it was an effort to host conversations and exchanges to really consider the differential impacts of COVID-19 for non-status refugee and immigrant women across Canada. We took on this kind of work from an approach that suggests that it's focused on social justice, thinking that we need more of a comprehensive analysis and a collective discussion of the social problems in order to really yield more effective social actions, advocacy, strategies, and responses. So what did we hear when we were thinking about the unique challenges? What is the impact of COVID-19, and what does this mean when addressing gender-based violence against non-status women across Canada? How can we better respond to GBV against non-status women in the context of COVID-19? We heard from speakers that mentioned that gender-based violence against non-status women was already a crisis. We learned that some of the new social conditions that we were referring to are actually long-standing and ongoing problems. We heard that the need to really move away from generalizations, which is something that really underscores the work of addressing gender-based violence against non-status women. So moving away from mainstream approaches, trying to understand those pieces. The need to really understand the harms, the implications from an intersectional lens. And in particular, when we heard this critique to more mainstream responses, the alternative and the option here is also to really narrate and understand experiences of race and gender and immigration status to try to help us understand what some of the issues are with and gaps are with existing services and responses. In addition to that, we're also hearing the need to valorize and center the experiences and the embodied knowledge of non-status women in the responses. So really emphasizing the knowledge and the expertise of like the long-standing work of social work movements and advocates who've been doing this, articulating this crisis long before it was named a crisis in this general tone, and who have provided a way and a way of understanding, right? So making sure who's being consulted with these response measures. There was also this need to really emphasize the work that's being done by service providers across different regions in Canada. We learned about how they're distributing their attention and their services, especially right now when we're being asked to isolate. So what we learn is that with the persistence of GBV in communities, there's a lack of strategies to abate what was like an exasperated issues that were coming out through this emergency. There's a lot of social disorientation caused by COVID-19 that's compounded by the need for agencies to stop serving clients in person, the need to be able to separate the social distancing. We can imagine how this was difficult for frontline workers in terms of being able to do wellness checks, or the fact that isolation is such a key tactic, a part of gender-based violence, and now there was no spaces where we could offer for non-status women to come together, spaces for drop-in, et cetera, that are necessary to kind of break that isolation. So when we're thinking about this conversation and what really came out at this roundtable in particular was just thinking that when we center the needs, we center the voices of non-status women, it becomes a conversation as well that allows us to highlight these blind spots to policy, blind spots in the responses. And in a lot of ways, what was being called out was the inherent violence, the inherent harm that's sourced from the very measures that we're claiming protect us. And this is not something new when we're analyzing and talking about gender-based violence against non-status women. It's something that really underscores how women may not be perceived as this ideal victim in the way that responses are currently structured. Claire, if you could share the last graphic, that would be great. So here we are, we're all in this together, this powerful emblem of the pandemic, and recent measures in Ontario have extended the emergency healthcare to uninsured populations, and which they removed the 3-week period for new residents. And so we see that there's political will, this kind of universal and equitable access to services as possible. And we need a comprehensive response that ensures that all human beings have access to these basic needs, but also at the same time, what we're being shown during this moment is our collective fates, how we're tied together. As was noted at our last roundtable as well, it's very important for us to understand this kind of work around liberation is intertwined with each other. And also at the same time, it's very important for us to know that the political will that we've seen requires continued demands, requires making public awareness around the issues so that this continues, the supports continue, and we continue towards this post-COVID. And so I'm going to just finish off with some of the calls that have been made, in particular focus on what has been the call from the Rights of Non-Status Women Network, saying that this is an opportunity for the federal government to address all of these gaps holistically by implementing a more broad regularization program to finally truly include all our family, friends, neighbors, and those who've been taking care of us in Canadian society. Thank you.
Thank you very much, Margarita. Yes, you condensed a lot of very important issues, and thank you for keeping the time. Without further ado, I'd like to give the floor to Michael.
Hi, thank you very much, Anna, and thank you for the introduction and for welcoming me to this webinar. This is, in fact, the first webinar presentation I've ever given, so this is quite a privilege and quite a rarity for me. So I'm learning as I go. As Anna mentioned at the beginning, I direct the Global Detention Project, which is in Geneva, Switzerland, and what we do is we document the conditions and laws and policies in place with respect to immigration-related detention in countries around the world. I could talk a lot about what we have always done, but I think I'll dive right into what we've been doing these last few months, because in effect, what we do changed dramatically. When the COVID situation, with the onset of the COVID situation, a few things happened that dramatically affected us. One of which was, for instance, the international human rights machinery ground to a standstill. And that machinery is something that we respond to a lot in the work that we do. In fact, a lot of the data and reports that we develop are very much directly meant to appeal to the reporting mechanisms that states have to go through as members of human rights treaties. Those treaty bodies based here in Geneva, we interact with on a regular basis. That whole machinery ground to a halt, as many of you may know, in part because there were no longer any meetings taking place. And so what we would do is we would submit written documentation regarding specific vulnerabilities or problems with respect to a given state's application of its treaty obligations. And those treaties, there are many of them, and which apply. An important one for us is the Convention on the Rights of Migrant Workers, an important treaty for many of the countries some of us live in, because those countries haven't ratified that treaty, like the United States, European countries, Canada. But it's a very critical treaty when we look at the issues of immigration detention, in part because the countries that support this treaty are countries like Mexico, like Turkey, and other countries that have become very important places of immigration detention as the destination countries in the global north put pressure on these countries to block migration. So detention has emerged as a critical issue in these countries. And so in the convention, there are very specific provisions relevant to immigration detention. So we can speak directly to this convention and states reporting on their obligations. This all ground to a halt. And at the same time, we began to realize very early that there was something else very special happening. Special may sound like a perverse word, but in fact, it is a bit special because all of a sudden the entire nature of immigration detention and the rationale for it to exist immediately came into question. And so we wanted to explore that. All the work we did reporting to treaty bodies came to an end temporarily, and we put all of our attention on this single issue, which was, what are states doing in response to this crisis with respect to this population of very vulnerable people? And so one of the inspirations for doing this early on was Spain. I don't know if all of you are aware of the case of Spain, but Spain was, I think, probably one of the first countries in Europe and globally to really look and say, oh my God, we can't keep people in detention any longer because it's no longer justified. We have a limit to the amount of time we can keep people in detention until we can effect a deportation. We know that that's not going to be possible. And so eventually, quite quickly, they responded by pretty much closing down all of their detention centers. And I think by early May, first week of May, there was not a single person in immigration detention. So we saw that, we saw the early moves that Spain had made. I think as early April, they were saying, oh my God, we're gonna have to start letting people go. And we said, this really is something important happening and we need to focus our attention on it. And so the way in which we decided to do this was to launch a survey. And we did it, what we did is we crafted a few questions, we kept them short, and we addressed it to every relevant governmental body around the world, every international organization, IOM, UNHCR, others, OHCHR offices, the Office of the High Commissioner for Human Rights, their regional and their national offices, to the National Human Rights Commissions or the NPMs, the National Preventive Mechanisms that states have, who are members of the OPCAT. And so all of these bodies, we developed this survey, we translated the right languages, we used in some cases the legislation on freedom of information where we thought it was necessary, and we started generating information, and we started generating lots of information. And you can see that, I guess I could probably give a link, I could put it in the chat here. You can see where this has gone, there. There's the link, and then there's a survey which is available in 5 different languages. That is here, and so we started developing and generating information from a broad range of actors: NGOs, ombudsmen's offices or national human rights commissions, interior ministries, IOM offices, OHCHR offices, UNHCR, from around the world, right? And so to date, we have over 200 entries in this platform. And to be clear, we get survey responses. Well, we just don't copy and paste the survey response into a document and put it in there. We contextualize it a bit. We report what they tell us to the extent that we have information that may be contradictory. We mention that. But it's very much a living, rapidly evolving phenomena. So what I thought I would do is tell you just a few of the things that we've learned from this to date, and then I'll take questions. So I won't take up too much time, but one of the first things is what Anna mentioned at the top, was this distinction between the treatment of people convicted of crimes and people who are in detention and not convicted of crimes. What I think in the Americans is often called civil detention or administrative detention. This is a form of detention which is distinct from incarceration insofar as, well, a number of things are very important. First of all, at least in Western liberal democracies, the notion of detention or incarceration is intended as a tool to reform people so they can re-enter society. It may not always be the case. In fact, it probably is rarely the case, maybe, that's what the intention is. I think sometimes the intention is to hurt people. But that is that's what's supposed to happen with incarceration for a criminal process. Immigration detention, as I don't think I'm telling anybody here anything new, but it's not about allowing people to re-enter society, but to remove them, right? It's to disappear them. So that is a very important distinction for us to keep in mind when we look at how states have responded to these 2 different populations of people deprived of liberty in these countries. So as we reported as my colleague Katie and I wrote in our entry for the Pandemic Borders project that Anna is leading with Open Democracy, we found that, at least early on, what was happening was that low-level people, low-level prisoners, people who had committed crimes that weren't considered very
We seem to have lost Michael for a moment. Michael, if you hear us, it would be good. No, I think Probably if you had an internet connection, if the connection is interrupted, Zoom kicks you out and kicks you back in. So
I'm back.
Michael,
Can you hear me?
Good.
I'm back, yeah? Can you hear me? Yeah? Okay. So we learned very quickly, or at least early on in the pandemic, it was clear that a population of people who we can argue about whether or not they should or should not be in prison in the first place. I don't want to get into that that particular debate, but it was clear that there was a double standard, that there was a forgotten group of people. There were cases like Spain where it was not forgotten, but Spain has a very strong constitutional framework with respect to immigration detention, somewhat like France as well. And there's a challenge to immigration detention in that framework that we don't see in other types of legal systems. That's a whole nother conversation. But in most cases, what we saw is that this was a forgotten population that was considered to be not very important. We could take steps to let out tens of thousands in some cases, or thousands of people in prisons, but the immigration population would remain, right? And so that evolved. I mean, since we wrote that blog entry, I think the situation has evolved. But nevertheless, that was one first message, okay? And it's changed a bit, and we can discuss that in questioning if people wish. Another very important lesson that we learned, and this is something that that Margarita made me think about when she mentioned the harms that emerge from the measures that are put in place to actually protect people, but they have a kind of an unintended consequence. Unintended or not, they have a harm, even though it's supposed to protect. So in the case, we can return to the case of Spain to illustrate this. Although by May 5th, I guess it was, Spain could report that they had 0 immigration detainees. 0, for the first time in the history of that system. And that system probably dates back to the early 1980s. For the first time ever, they had 0 people in immigration detention. But it wasn't actually true. What they meant was people who are in facilities that are intended to deport people, those facilities are closed. However, the facilities in the enclaves and the coast on the northern coast in Morocco, on the coast of Morocco in the Mediterranean, there are facilities that are not detention facilities, and people in them are not given detention orders, and there's been no judicial request to detain them. So it's unclear who has custody of these people. They're supposed to be reception centers. These went under lockdown. Now, this was to safeguard people. But all of a sudden, this population, in one case, more than 1,000 people in dormitories without any possibility of finding any social distancing, or locked inside a building for the first time because of the response to COVID. And this is an important pattern that we've seen across the globe, which is that facilities that are meant to be receiving people who are making a claim of some kind with respect to maybe an asylum procedure or some form of international protection. They're not supposed to be detained, so there is no detention order, so there is no judicial process, so there is no challenging their detention, are effectively detained. And no one knows when that's going to end. And we can argue over whether they should do this or shouldn't do this, or other people were also being locked in. Some countries that went under confinement, so everyone was locked in their home effectively. But let's be clear, in these places, there is no possibility of social distancing. So the impact is really intense and potentially catastrophic. And it's also dramatic in that it continues, even as countries have tried to go through this deconfinement or loosening of safeguards and measures and letting people out, and it's they're still, these reception centers are still under lockdown. And an important case in point is Greece. On the islands of Greece, Greece, as many of you may be aware, did not feel the full force of COVID like other countries, like neighboring Italy did. And all the fears that Europe said about arriving refugees with COVID were all, as we all know, just a bunch of hot air, fear-mongering. There haven't been cases, or very few, I think any of people arriving by sea. So nevertheless, as Greece has opened up, not its reception centers have not. These people are still under lockdown, and there's no apparent reason for it. So that is one of the important patterns we've seen too. Another one that's been quite important, the efforts by some states and not others to quickly realize the importance of firewalls in public policy with respect to protecting both migrants, refugees, asylum seekers, and host populations. Now, some of you may be aware of the concept of firewalls. I'm assuming you are, but my time is, I'll talk about firewalls in Q&A if that comes up. So I'll leave it at that. Thank you very much.
Thank you very much, Michael. It's a very, how can I say, it's a sadly very rich topic, and there's so many things to be said, including for my own country of origin, Greece, that I don't feel very proud about in this respect. Petra, the floor is yours.
Thank you so much, Anna and Claire, for having me, and also to Margarita and Michael. For me, I feel quite lucky to be on this panel because I'm also a member of the Rights of Non-Status Women's Network like Margarita, and I've worked on immigration detention issues before I transitioned into this new project, trying to understand how new technologies are being used to infringe on people's human rights. So what I'll do today is I'll highlight some of the main things I've been noticing over the last little while at this intersection between migration management technology and how states are responding to the COVID pandemic. Because what we're increasingly seeing over the last number of years is this obsession with something that people have called techno-solutionism, or using these really sexy tools for intractable problems that are difficult to solve. And just over the last few months, we've already seen very interesting uses of technology, sometimes dubious, such as virus tracking apps or contact tracing applications that states are now thinking about in terms of a response to the pandemic. But how will these be differentially experienced by refugees, by people without status, and by people in immigration detention? Really, in my work, I try and draw out how important it is to consider the context and the ecosystem in which these technologies develop. Because as the previous two speakers so cogently already highlighted, we are increasingly seeing anti-migrant sentiments, xenophobia across the world, but then also this obsession with biosurveillance, or using the human body as a way to try and surveil people who are on the move, and now also who might be kind of COVID positive. But it's so important to remember that pandemic responses are political. They're not neutral. And that's something that Michael just mentioned as well. Refugees and people on the move and people crossing borders have so long been tied to these really damaging tropes of bringing in illness and disease, and therefore justifying increasing incursions on people's human rights. And this isn't anything new. So in my work over the last few years, I've been trying to understand how new technologies are making their way into a variety of different ways that a person might be experiencing their migration journey. So this can mean anything from, for example, a drone or an automated vehicle that's used, for example, to surveil migrants who are coming across the Mediterranean to try and claim asylum in Europe. We're also seeing all sorts of automation make its way into Canada's immigration system and visa processing. So you now have automated decision-making or algorithms making certain determinations about whether or not you will be let into the country. And we're seeing this kind of, again, obsession with these really strange tools. For example, an AI lie detector project was piloted in Europe, which purported to be able to tell whether you're telling the truth based on your interaction with an avatar. But what's really troubling for me is how these tech experiments are tested out on communities that become guinea pigs very easily. So for example, we've seen that in the past, the Bureau of Investigative Journalism investigated that previous technology used for contact tracing and population tracking of refugees is now being used for COVID tracking as well. There's a very clear linkage here. Really, what I want to leave you with today is the impacts on human lives and human rights are real. This isn't just some sort of futuristic conversation. And we can look at it from a variety of ways. We can look at privacy and data rights. We can look at freedom of expression. We can look at bias and discrimination, for example, because we know that technology is not neutral. We know that algorithms, for example, are racist and sexist. We know that people of color and communities of color are over-policed when different technology is used, for example, for predictive policing. We already are seeing incursions of technological companies into immigration detention, for example. And a variety of private actors are selling these tools to make detention of migrants easier. Yeah, I know our time is short, so I'll wrap it up. But I really wanted to, again, leave it with this idea that the context matters. And one of the concerns is that there will be a co-optation of these so-called COVID tracing technologies to then basically be able to track and trace humans who are on the move and crossing borders. Because states are obsessed with making migrants trackable and intelligible and knowable. And really, it's some of these deeper maybe questions that we have to ask ourselves as a society. Who gets to participate in the conversations around proposed interventions to COVID? Which communities become guinea pigs for experimentation when it comes to these sexy new tools, right? What kind of oversight and accountability exists? And who gets to participate in deciding what our post-COVID world looks like? At the end of the day, what I'm particularly troubled by is this kind of hubris of the private sector and big tech making these incursions into the migration space. And it's this allure of quick fixes or band-aid solutions that don't really address the systemic reasons why people are forced to migrate in the first place. Because these are complicated issues. These are difficult things we have been grappling with for decades or centuries. And it's really quite interesting that kind of the private sector seems to think that they have a solution in an app or an algorithm. So really what's needed is transparency. We need to know what's happening. We need to understand how these incursions are happening. We need more oversight and accountability. And really, we need to pay close attention to what is happening because a lot of it happens behind closed doors. So I think I'll leave it there and I look forward to our discussion. Thank you.
Thank you very much, Petra. Yeah, so it is true that particularly under the current context, we're very easy to say, oh yeah, that would be wonderful to have an app that can let me have this information, and we don't realize the privacy challenges behind it, and also the possible use and abuse in the near future of these technologies as they develop. And I totally agree with you that unfortunately there is a lack of transparency and accountability when these seemingly neutral technological solutions are adopted, and there are even legal questions that need to be further developed as to who is responsible if you're tracked by an app, by a smart algorithm, and there is no clear person behind it. So there's no immigration employee, there's no administrative person that can be questioned about their decision. Michael, you also raised very important questions because precisely a detention in the case of migration is not meant to reform somebody. It is in theory only practical to facilitate return. And I would like to say something here, which I was very astounded at finding out, is that Canada has no maximum limit for detention for immigration purposes. Although I know the detained population for migration-related reasons is quite small, the lack of a maximum duration is very worrying. And of course, all the issues that Margarita raised about, and that have been unfortunately very much on the news these days, about how, for instance, a woman without status may be afraid to call the police, may be afraid to turn to the authorities, rather than see in the state her ally and her supporter. So let me take a couple of questions from the chat box. We had a question for Margarita with regard to trans people, or I suppose I can expand the question and speak about LGBTQ+ people. So this is a question for Margarita, and also, for Margarita more generally, the need to acknowledge that precarious workers with precarious status should have clear paths to permanent residency, and whether the crisis can be an opportunity. That's a conversation to be had. Let me take a few more because suddenly our chat has livened up. A question for Petra. should we really push back these developments and say, no, this is not the right time for increasing machine-based surveillance and tracking? I want to add here also, also in relation to these last days, developments on police violence, there has been this call for having also cameras on police officers, which I confess for me is also worrying. Because on one hand, of course, there are good reasons for it, but this adoption of technical solutions to actual real problems that I think should be addressed at the source, not at the technical level, is for me kind of a patch that can have very important privacy implications. Another question also for you, Petra, is the role of the private sector. I think it's very, very important how the private sector sometimes pushes for these technological solutions that translate to multi-million, dollar or euro contracts. So I think this is it for now, and maybe I can give then an opportunity to Michael to finish the last point that he was about to tell us when he realized the time was running up. So actually, let me start with Margarita.
Great, thank you. So I'm going to kind of, I'll be able to, I think there was two questions there. So I think to kind of echo some of the last pieces that we were hearing about transparency, accountability, especially when we're trying to think of centering certain experiences, voices. When we think about queer and trans communities who've too often been silenced in these conversations, and we have to think about the violence against and within communities as well. That's really important. And so I think right now, the need to ask, like, who's being consulted, which experiences are being, the spaces right now that we're trying to host, the idea is to leverage conversations and bring together, have this discussion, and bring together different organizations and groups that are doing that work. Understanding, I think here what's really key is that there's groups that have been doing the work, who have been identifying this kind of longstanding crisis, who have been identifying the forms of state violence against the queer and trans community as well, thinking about non-status, thinking about those intersections. So those are places where we then know that our ideas around accountability, transparency, making sure that that certain voices are included in those conversations. And making sure that there's equitable ways for people and groups to participate in these conversations as well, and to be leaders. So reflected in the setup of organizations and the work as well, right? And then in terms of the question that was mentioned around Trudeau acknowledging more of a need for pathways to permanent residence for migrant workers, I think this piece is really important because what we're seeing is political will. What we've witnessed in the last few months. And so it's about furthering that work, making those demands. And if anything right now, at least how we're speaking to this, even with our group, is we're thinking a lot about how COVID-19 is essentially, it's opened this window and this opportunity for us to also be bold. So when we were talking about what's inherently violent, what's inherently harmful, it also means needing to call out those same states and systems that we participate in that are perpetuating violence. So that kind of reflection is a requirement. And those pathways mean, again, similar to what Petra's saying, it's not necessarily that we have a solution. It's more about bringing in collectively thinking about this, making sure and centering groups that we know are most vulnerable so that those blind spots, those responses and policy measures are responding in more equitable ways.
Thank you very much, Margarita. Michael, and may I ask, Michael, may I add another question to you and Petra? So the gender dimension of your reflection, which I think is also interesting.
Did you want me to pop in now, or I was unclear on that?
No, I wanted to give you the opportunity to say the last point that you were about to start saying, and also reflect on the gender dimension of detention, which is truly a very important issue.
Okay, so I'll just say something about the gender issue. I mean, I think with detention, gender is a critically important issue, and transgender issues as well. I was in a call a few days ago with a group of transgender activists who are working on criminalization, but not in the context of migration. And they were curious to see how we dealt with that concept. And gender, transgender, they are critical issues principally for the same reasons that the issue of COVID is very important, that there's often very little opportunity to be in a space that's different and safe from other people. And with the COVID crisis, when you look at countries, I don't know, I mean, Malaysia, to give you an example, where they round up hundreds and hundreds of people who are placed into a single space. Obviously, the issues of gender and the vulnerabilities of different genders or transgender people become very paramount. So I think that with COVID, what we've seen is, I guess, a dramatization or a bit more of a dramatic impact on people with gender crisis for the very reason that they're often not allowed to separate from other genders and they're vulnerable as a result. With respect to the firewalls issue, there's an interesting comment here about issues of trust and firewalls being effective in trust situations, and that's obviously the case. What we found is what's interesting in the survey that we've done and the kind of COVID responses, we've seen a lot of countries really quickly recognize that whereas before they weren't implementing firewalls of any kind, they realized they needed to now because this was a special situation. And so very quickly, countries like Ireland, which it's kind of a low-hanging fruit because they detain so few people as in any case, but they immediately realized that people were not coming in to say anything during the crisis or to access needed medicines or any kind of assistance that may be related to the health crisis, primarily because they had no faith that they wouldn't be reported to officials. And so they quickly implemented these measures. And so we've documented that every time it's come up because we realized that there was a pattern to this. Some countries recognizing it and others not. And it's quite dramatic, the cases that are not doing this. South Korea is one. If you look at our platform and look up the problems related to their failure to do this and the impact that not doing this, lack of faith in the government, and the crisis of COVID is really it's kind of a perfect storm of problems. So that's what I wanted to say about the firewalls. I think one of the silver linings or unintended benefits, perhaps unexpected benefits of this is that I think people are learning, societies are learning, institutions are learning, bureaucracies are learning that there are measures that we should be taking. COVID woke us up to them. And I think the larger thing that we've been focusing on is just that. People waking up to detention and whether or not it's effective, not just during COVID, but looking more, looking down the line. Is it something that we really should be pursuing? And I think people have begun to question it in a way that they hadn't before. So I'll leave you with that. Thanks.
Yeah, thank you very much. Yeah, that is the firewalls are important at any time, but we can realize that they're how crucial they can be under a pandemic and when people are afraid to look for assistance because they think there's a heightened awareness that they are non-status and they should be locked up. Petra.
Great, thank you. Okay, I'll try and tackle these questions quickly. So Sangeeta's question regarding recent announcements around AI not being used for policing and whether there is an opening to push for oversight or less machine-based surveillance and tracking. I mean, I guess not to answer a question with a question, but I wonder if, we need to, again, kind of think about the context that we're working in and who actually has the ability to challenge a technical solution or surveillance tech that's being used against them, right? It's one thing for someone who has citizenship or for someone who, whose social location is of a particular kind to be able to do so, or a civil activist or somebody like me, versus a refugee or an asylum seeker or somebody who is really quite vulnerable to this kind of over surveillance and even automated decision making, because oftentimes people don't really know that this is happening to their application or as they're moving their way through the system. So I think, you know, overall, more literacy around these issues needs to happen in spaces like this, but also among communities and among activists and NGO workers and lawyers, because the incursion of these technologies is really quite stark. And this brings me to Selina's question regarding the role of the private sector and how, you know, which specific companies there are and what we can do about it. I mean, I'm constantly shocked almost every day. There's some sort of new company, some sort of new public-private partnership that occurs in the migration management tech space. So if you are into this, I would urge you to look up Palantir Technologies. They're a very problematic data scraping firm, which has had links, for example, to ICE in the United States, in the immigration enforcement system and the detention estate there. Just a couple days ago, some brilliant journalists uncovered that McKinsey, which is a huge global consulting firm, was awarded almost a €1 million contract to help assist with the Greek asylum system pushbacks. Like really, really troubling stuff. The public didn't really know about this, and this all happens kind of in these shadowy backdoor deals. Again, transparency is hard to come by in this space, and becoming aware of all these different players, I think, is really paramount for all of us to then be able to effectively push back against this. And I believe the last question was Monica's regarding the gender dimensions. It's something that definitely needs to be looked at more in this kind of tech and human rights space, and tech and migration as well. And there's been some really great work done, for example, on how violence against women is changing now with more technological tools at the disposal of, you know, the abusive party. So, for example, smart home tracking technology and things like Alexa that is able to, you know, monitor temperature or unlock your doors is now increasingly used against people who are victims of domestic abuse. And I can share an article that really quite cogently explores the gender elements of this as well. But the other flip side to this is that we know, for example, that algorithmic decision-making and facial recognition is usually trained on data sets that are very white and very male. And so they're not very good at recognizing faces of color, women, or basically a face that doesn't look like what it's used to. So there's this other dimension too. I'm not saying that maybe these technologies should be more accurate because then they would do their shitty job better, but I'm just saying that, you know, there is a discriminatory element to how the technologies work in and of themselves.
Yes, it's not, technology can be very, very good, but of course it depends on what is the use we make of it. And I think there I would like to comment on the role of public opinion, because I think, first of all, in any case, public opinion is divided on these issues. And I would say even in a country like Canada, where immigration is part of the national identity, the idea that people with precarious status or without status are seen as queue jumpers. So, and of course, speaking about Europe and different European countries that I know well, there are different views which have sometimes relate to, oh, these people violated the law, without examining, you know, the impossibility of non-violating the immigration law. Or there are also views like these people do not belong here, and, you know, human rights are good, but there are variations, you know, varying degrees of humanity in. And I think what is particularly interesting, and I will agree with Margarita, it can be an opportunity right now, but it can also be a challenge, a negative opportunity, that right now in relation to the pandemic, people are very worried about the pandemic and how they can protect themselves. So they, regardless of what are their views on migration, on asylum, on non-status people, on, you know, vulnerable communities, they may be more easily convinced that more technology is better because it can provide protection from the virus, without seeing where this can lead to or how it can affect people who are, you know, in an uncertain situation. But let me close the webinar with a positive question that was asked by one of our participants, which is, can we say, what can civil society do to address these issues? I think you have already raised some of this, and what all three of you are doing is partly the answer, but maybe I can give you the floor for 1 minute to say, okay, what can we do to make things better? Margarita?
Sure, great question. And I think that what I'd like to highlight, you know, the work that's being done by the Rights of Non-Status Women Network, because that's a network where you have civil society leaders, advocates, community members. So you have groups of people that are coming together trying to think about the issues at hand from different perspectives. And that kind of advocacy work is so important. And we know across different sectors, there's been kind of what they call this advocacy chill. There's been less of that work that's possible to do. People are overworked, they're doing it off the side of their desk, this kind of thing. So the need to also try to be part of collaborating with these networks, encouraging that be a part of also the work that we're doing. As Petra mentioned as well, there's this need for this to go outside of academic spaces, outside. It needs to be more collective, more community style forums. And I think that kind of interdisciplinary, cross-sectoral kind of work is a necessary, I think, characteristic of the collaborative work that we should be doing and working towards.
Yes, indeed. We need to stick to the non-converted. I totally agree with you. Michael?
I think that one thing that can be effective is asking questions. One of the things that we found, to go back to the case that I've mentioned a lot, is Spain. Spain let all these people out of detention facilities, and no one knew where they went. And it's not important that we need to track where people are, but are they being helped? Are they receiving the care that they need, especially during a time of pandemic? And I think it's really important that we continually ask what is happening to people who are supposedly yet in still some form of custody. Have they been given the assistance they need? We haven't gotten answers, and we've been asking a lot. Now, from country to country to country, where we have seen people released because of COVID concerns, it's often nobody knows if they've received the kind of assistance they need to protect themselves. So I think that's an important agenda item for civil society.
Sorry, you were not hearing me. I said, yeah, I agree. Thank you very much, Michael. Petra?
Not a lot to add to these wonderful interventions. I would just say to not be afraid of new topics like technology. I certainly was when I started learning about this, but I think we need more people from different sectors and different disciplines and different lived experiences too, to be around the table to try and unpack some of these really complicated ideas, and then also to hold states and private entities to account. Because once we know what's happening, it's a lot easier to then come up with a strategy of challenging some of these things. Thank you.
Thank you all. I think this is a very positive note on which to conclude our seminar. And as happens in relation to also the more general discussions about inequality and racism these days, I think, yes, we should make this an everyday concern, not just a one-off day or a statement, you know, or a formal occasion, but something that we can think of in every day in our work and in our life and in our civic participation. Thank you very much all for staying with us for this hour. I believe you're all, or if you're not, please do. I believe you're all registered in our mailing list, so you will hear from us about our next, meetings on the web and hopefully slowly also in person, starting in September. Thank you very much. Have a great afternoon.
Thank you.